Peds Patrol here, and let's talk about foodborne illnesses when you're traveling and why this is so important to prevent things like this from happening. Such a tragic case where a mom and a child passes away due to foodborne illness. And keep in mind that it can happen both internationally and locally as well. As you're aware, based on my previous videos, we've had a lot of food recalls in the past year. So here are some important tips that you need to be aware of. So tip number one is always making sure that when you're planning for a vacation or a holiday, know your weather, know your environment, and know what you're getting into and plan accordingly. Number two, wash your hands, whether it's with warm water and soap or hand sanitizer. Make sure that you wash your hands before you're touching anything or any object. Number three, an amazing resource that we have in Canada is Travel Canada. Here you can actually look at all the countries that are available and what their health and safety risks are. And if you do need to get any preventative measures like travel vaccines or travel medication, talk to your family doctor, go to a travel clinic, and learn what the options are available. There are a lot of foodborne illnesses that can be preventable by getting a vaccine or getting medications. Usually, you have to prepare at least 1 or 2 months in advance. So once you book your ticket, book your doctor's appointment next. Children are very prone to traveler's diarrhea. Sometimes it's viral, but in worst cases, it can be bacterial. And this is where medication may be needed and being in a hospital may be warranted. When you do get sick, such as nausea or vomiting, one of the things that you really need to think about is oral rehydration solution or therapy. Carrying something like this in your travel pack is a really great idea to help children manage their fever, their vomiting, diarrhea. You want to make sure that you're not using just water and not using solutions like Gatorade or anything that has a high sugar content in it, because what you want is to keep the salt and sugars in your body, not leaving your body. Something like Pedialyte is balanced. Number five, if you are traveling and coming back with a fever, you typically do have to go to a hospital or go to your family doctor for a visit, because a fever in returning traveler can indicate many viruses, bacteria, parasites that are not really common to the land that you are living in. That can include things like yellow fever, malaria, dengue, or other conditions, which is why it's important to get tested if you do have a fever. And last but not least, number six, making sure that you check in with your credit cards, your insurance providers to buy extra travel insurance just in case things like these happen. You'll be surprised how much money you'll have to spend if you're not insured to take care of yourself in the hospital. So be safe.